A lot of folks plan to work a pretty reasonable length career. Of the 64% of workers who expect to do it, only 28% are actually doing it. Take, for example, a couple I talked to recently who's having to care for elderly parents, and it's literally become almost a full-time job for them. Hey folks, this is Colin Richards, president and founder of Lord & Richards, and once again, I'm excited to be talking to you about amazing subjects that are so critical and important for your retirement. And today we're going to be addressing one of the most frequently asked questions I get. We're in a series on the top questions that retirees or pre-retirees are asking about retirement. And in this series, we've covered everything from how much income do I need? How do I get that income? How much risk should I take? And now in this particular series, we're going to be talking about how much do I need to cover the challenges of healthcare and retirement. And we're going to have 3 segments on this subject, and so I hope you'll stay tuned through all 3. But remember, if you miss us on the radio, you can catch us at Lord & Richards on YouTube, as well as your favorite podcast channel. And today I'd like to start by discussing the challenges of people retiring for longer periods of time, earlier and longer. And isn't that the dream that many folks have is, hey, Colin, I would like to retire earlier and I'd like to live a long, full life in retirement so I can really enjoy these years that I've been saving up and preparing for all of my working career. And that's wonderful. And as a matter of fact, in my public events and in private conversations with folks, I'm encouraging them, look, if we can develop a plan to help you achieve financial independence and retire earlier even than you had originally thought, that's a win. It's not always possible. It depends on how well you've saved, how big your budget is. A lot of factors go into retiring earlier, and I'd like you to take a look at one of our podcasts or YouTube videos on that subject. But today I'm going to talk about some study that has been done by J.P. Morgan. J.P. Morgan put out a study not too long ago on retirement itself. And here are a few key takeaways. Number one, 72% of currently healthy 65-year-old couples are going to see at least one spouse live into their 90s. That is an amazing statistic. Because if you're thinking about retiring in your early to mid to late 60s, that could be a 30-plus year retirement. And think about it. When you're working, it's all about stashing cash, getting your match, free money, my favorite kind of money. If you're wise, you're also stashing money away in tax-free accounts like Roth IRAs and other tools that we use here at Lord & Richards. But once you get near or in retirement, the whole game changes. It's an entirely different game. It's like football. You notice that there's one game played when you're 80 yards from the goal line and a completely different game played when you're 5, 4, 3, 2, 1 yard from the goal line. And when you get close to retirement or you're actually in it, you are playing a short game. And it's a much harder game to make progress in. And that's why you need specialists, fiduciaries, financial planners who will help guide you through this most critical and important phase of your planning, which is how do I make my money last for my entire life, your entire life. And if your life expectancy as a couple is going into your 90s, singles may well live into their 90s as well. But the challenge oftentimes is a couple will lose a stream of income, right? If you're taking 2 Social Security streams, the smaller of the 2 is going to drop away. And so with a high percentage of spouses living into their 90s, we need to start planning and utilizing different tools, modern tools, to address that challenge. Here's another very important statistic. A lot of folks plan to work a pretty reasonable length career. I'm not talking to a lot of people who are trying to retire at 40 and 45. I think that's an entirely different conversation. And a lot of those people go back to work because they discover how bored they are. But for those who are saying, no, I want to work a reasonable length of time until maybe I'm 65, 67, full retirement age for Social Security, or even 70. I love my career. 28% are actually doing it. Of the 64% of workers who expect to do it, only 28% 8% are actually doing it. The actual age is most frequently 62. And I am talking to a lot of people who either want to or because of challenges are having to retire earlier. Take, for example, a couple I talked to recently who's having to care for elderly parents, and it's literally become almost a full-time job for them. Here are the top reasons. Company downsizing, the perils of private industry, right? If you have a government job that's pretty secure and gives you a pension, enjoy that. Pensions are going the way of the dodo. Number 2, healthcare. Healthcare issues. 36% of the time, these folks are retiring early because of health challenges. Either they're taking care of other loved ones or because of their own needs, and particularly care of spouse. That's over 10% of the time. So company downsizing, healthcare, care for spouse, all things that you may not have planned on that resulted in you retiring earlier. This is why we need to develop a comprehensive financial plan. We call it a financial independence review. That's our process at Colin Richards. And we sit down and help you prepare for different possibilities in retirement. What if we have to retire earlier? What if somebody gets sick? What if we live into our 90s? And so as we're looking ahead, here's how I want you to start thinking. Okay, and I talk about this a lot. Think about front loading your expenses in retirement, okay? The go-go years, 60 to 70, when you're really planning on being active and enjoying your retirement, maybe traveling, seeing the grandkids, taking up new hobbies like golf or fishing, whatever it is, those discretionary expenses get a little bit higher. And then those slow go years, when we're getting a little bit older, pushing 80 or into our 80s, we're spending maybe 20 to 30% less. I'm not saying you should drop off your budget off the cliff, but just be prepared for the possibility that your lifestyle will shrink a little bit in terms of its breadth and its cost. And then we enter the 80-plus years, the won't-go years. Notice I didn't say can't go, don't go. I'm saying won't go. This is where you're trying to get a family member to go with you. Maybe you're still active, but they're not particularly interested in taking trips or doing some of the fun things. But due to healthcare costs, we suddenly see that budget starting back up. So it's kind of a higher cost in the early phases of retirement, a little bit lower as we move to the middle phase, and higher again at the end. And so folks, don't scrimp in the early years. I want you to retire and spend according to your budget in a way that allows you to enjoy that retirement. Now, in our next segments, I'm going to dive actually into healthcare and what kind of challenges that's going to create for you, especially if you don't plan ahead. I want to talk to you about this. My team and I would love to visit with you about how you can plan ahead and prepare for these kinds of situations in retirement. It just starts with a simple phone call.